afternoon. My name is Lauren Mills, and I'll be doing a postpartum assessment today. To begin my assessment, I'll ensure that my patient has privacy and dignity throughout the entire assessment. I will complete my hand hygiene, and I'm going to introduce myself to the patient. Good morning, Mr. Jarnett. My name is Lauren. I'm going to be your student nurse today from Germanna. Okay, so I'm just going to be completing a postpartum assessment. Can you tell me your name and date of birth?
Katie DeJarnett, 12/15/88.
All right, I'm just going to check her bracelet and ensure that is correct. It is. I just wanted to go over your birth history with you really quick. I looked in your chart and I see that you had a vaginal birth with no complications and no use of forceps. Is that correct?
Correct.
Excellent. And this is your first child?
Correct.
All right. And then I would assess her vital signs, including a temp, blood pressure, pulse rate, and respirations, all within normal limits. So we're going to start the assessment, and we're going to start first with your breasts, okay? And I looked in the chart and it says that you were breastfeeding. Is that correct?
Correct.
All right. How's it going?
It's going well.
Excellent. Have you noticed any cracks, ulcers, or bleeding of your nipples?
No.
Any swelling or sensitivity to your breasts?
No.
Okay. And have you noticed any engorgement?
No.
Okay. All right. So if you decided that you wanted to start bottle feeding, I would let you know that you should be wearing a tight-fitted bra for approximately 24 hours a day. 24 hours a day is best, 7 days a week, and that's just going to go ahead and inhibit the milk production in your breasts. You would want to be careful with any type of stimulation, both from your partner or from it being in the shower and letting the water run over your nipples, just to kind of, like I said, inhibit that milk production. Okay?
Got it.
All right, so next we're going to be moving to uterus. So I would keep her as covered as I could. I would place my hand on the pelvic bone and my other hand at the umbilicus, feeling for a firm uterus, which I have. We're about U-1. I'm looking to make sure her uterus is midline. If her uterus wasn't midline, at that point in time, I would have her empty her bladder and then I would reassess. If her uterus was boggy and not firm, I would keep my hands in place and massage the uterus until it became firm. All right, and have you had a bowel movement since being with us?
Yes.
Excellent. And have you urinated?
Yes.
You have? Okay, was it normal?
Normal.
All right, no pain or anything like that?
No.
And a normal amount?
Yes.
Normal stream?
Yes.
Excellent. All right, I'm just going to assess the lochia, and that's just going to be the postpartum drainage, and it looks like she is lochia rubra with a moderate amount, so that is a reddish-brown color with a few clots. The next step for her would be lochia serous and then lochia alba. All right. She did not have an episiotomy. If she did, or a C-section. If she had an episiotomy or a C-section, I would be assessing for any redness, edema, ecchymosis, drainage, and just for the approximation of the incision site, you want to make sure it's well approximated. The next step in the assessment would be the Homan sign, which is not really utilized much anymore. But in that step, we would be assessing for any blood clots in the bottom of her legs. We would be assessing for any pain, tenderness, swelling, redness, and heat coming off the legs. Have you noticed any of that, Mr. Jordan?
No.
All right, excellent. I'm not feeling or seeing anything. The next step in the assessment is the emotional aspect. I looked in your chart and I don't see any history of any postpartum blues or depression. Being that this is your first labor, how are you feeling overall?
I'm feeling good.
Excellent. You said that breastfeeding is going well.
Mm-hmm.
From my standpoint, it doesn't seem that you are in any risk of that, but if anything were to change, as always, let us know, okay?
Okay.
All right. And if she was a RH negative mother exposed to RH positive blood, then I would ensure that she got her RhoGAM within 72 hours of delivery. And that concludes the postpartum assessment. Is there anything else I can do for you, Mr. Jarnett?
No, ma'am.
All right.